We'll also be voting on 2 bills from Senators Isakson and Casey. Senator Isakson has been an example of statesmanship and service to both this committee and to the Senate as a whole. He has always been one of the senators who we could count on to work on the side of the split screen that's trying to get results. For example, Senator Murray and I occasionally get stuck on an issue, and not always, but sometimes we do. And when we were doing that, working on fixing No Child Left Behind, we got stuck on an early childhood education issue that she wanted and I couldn't support. So I stepped back and asked Johnny to work with Patty to see if they could work it out. And of course they did, because of their respect and trust for each other. And then again, when we were working on the Workforce Investment Act, we'd been stuck on partisan differences for about a year. And again, Johnny and Senator Murray worked together to reach a result. So I thank him for that service. We'll miss that service, and I thank Patty for it as well. Johnny has the capacity for getting results because people trust him, and he has the skills of a legislator. So I'm not surprised we have 2 more bills from him, along with Senator Casey, to consider today. The first, the over-the-counter markup monograph Safety, Innovation, and Reform Act, would modernize the way over-the-counter medications are regulated and brought to market. The reforms aim to protect public health and encourage the development of new products to better meet the needs of patients. This is more important and difficult to do than it might sound. When we were working on the 21st Century Cures Act, I asked Janet Woodcock, the director of the Center for Drug Evaluation and Research at the FDA, if there was anything that she needed done in order to do her job well, but had never been able to get done because it was too hard to get it through Congress. She said it was the over-the-counter monograph, which hadn't been reformed since the 1970s. Well, Senator Isakson and Casey have taken something very important, very hard to do, and they've taken another step in getting it done. And second, Scarlet Sunshine on Sudden Unexpected Death Act, which will provide grants to help states prevent sudden unexpected infant and child deaths and to help better understand the causes of these deaths.